to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Exercise and Sports Science at UNC Chapel Hill, and the co-host of JAT Chat with Dr. Radzak. Today, I have the pleasure of being joined by Dr. Meredith Madden, who is an assistant professor in the Athletic Training Education program at the University of Southern Maine. Dr. Madden is the lead author of Become a Health Literacy Champion, Strategies to Promote Health Literacy and Athletic Training, in the Diversity, Equity, Inclusion, and Access special issue of the Journal of Athletic Training. Meredith, thank you so much for joining me today.
Thanks for having me.
So starting off with a very broad question for our listeners here, what is health literacy and why is this concept so important for our overall health and well-being?
Thanks for the question. So I'd like to start by addressing kind of the last part first, as it's a topic that I am particularly passionate about. So health literacy plays an essential role in enhancing patient care. And I really believe that athletic trainers can truly make a difference, by advocating for health literacy within our healthcare system. And all healthcare providers have the potential to learn evidence-based practices and implement them effectively and efficiently to enhance our patient outcomes. And in the field of athletic training, we have this unique opportunity to provide care across the continuum where patient education and quality care principles, such as that patient safety, patient centeredness, and equity can be prioritized and addressed early on. So in terms of what is health literacy, I think there are a few ways to look at this question, but I always think it's really important to start, at the beginning, at that strong foundation. That's how we build a house, right? So we build that foundation first. So I always go back to that lens of what's the definition of health literacy and kind of break it down. So there are a few definitions available, but in the article, we offer one that's kind of widely used and accepted, by a lot of federal and public health organizations. So personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. But again, this is the definition of personal health literacy, or that's the perspective of the patient or the individual. So there's another side to health literacy, and that's organizational health literacy, or that's the responsibility of the healthcare provider. So that definition is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So if we look at, the two definitions, we can see that there are similarities and, that it's about empowering patients to be active in their care. And organizational health literacy definition focuses on enabling patients, right, to find, use, understand, right, to make those decisions and take actions for health-related decisions and, for themselves or others. But that other key word was the concept of emphasizing equity, right, and through quality care.
So two words that you just said that really stood out to me was empowering and enabling in our patients. And I think that's so important and impactful as we're thinking about how we can enhance our patient outcomes, but just how we can just help our patients in general and our athletes. So you alluded to the difference between personal health literacy and organizational health literacy. As I was reading through, you mentioned reading through the article, there are 10 attributes of a health literate healthcare organization. And for the paper, you all identified 4 of those 10 attributes to be approached in this athletic training setting. Can you just provide us a brief overview of those 4 attributes of a health literate healthcare organization?
So my hope was to sort of bring a practical approach for athletic trainers. And so I drew on my background in athletic training and public health to bring kind of this concept that's already out there of a health literate healthcare model. And it's really what inspired kind of the title of the manuscript, right? To be a health literacy champion. And it's like, what does that mean? So to promote these ideas and these concepts with this kind of positive intention, this positive effort and advocacy in daily clinical, and organizational practice to just kind of move towards our optimal patient and healthcare outcomes. And that includes our health equity. And the message of that hope was kind of for athletic trainers and for athletic training programs and staffs for us to feel empowered too, right? To feel part of the broader healthcare system and to contribute to the national health literacy goals and objectives that kind of already exist. And we as athletic trainers, we play a critical role in interprofessional, education and collaborative teams, and health literacy and health equity are a shared responsibility for patient outcomes. And these factors don't exist in isolation, for patients. Just because they see the athletic trainer, they go see their primary care provider. Those aren't in isolation, right? So, every patient has health literacy, right? Every patient has social determinants of health. And even if the athletic trainer is the primary kind of care provider, they see us first, we also have that responsibility to be aware and be kind of confident practitioners, in health literacy. So the four that you've asked me to describe the four. So the first one was attribute number 3. And this is starting, educating the workforce. And that's simply adding education opportunities that are specific to health literacy, social determinants of health, health equity. But I think this can be incredibly impactful, right? Because we can generate enthusiasm and we can have a foundational understanding of the principles and information to then be able to build the next steps. And I would encourage athletic trainers to be creative about our educational resources. Look for podcasts, right? Look for articles from other fields that do health literacy and health equity research frequently and consistently. So public health, pharmacy, they've been doing this for quite a while and they have great resources. So find where that overlap is. Attributes 6 and 8, they were specific to verbal and written materials. I'm going to talk about them together. So as athletic trainers, we do these things quite often, right? It's our patient education. It's our patient engagement. That's all the time, right? But in terms of presenting them as starting points for assessing or enhancing our practice to move towards becoming that health literate healthcare model, one form of communication might feel either more exciting, right, or more doable to tackle as a quality improvement initiative. However, not, all ATs have control over maybe updating or changing written forms. So that might take a little bit more advocacy or partnering with administration or leadership, if you want to change a consent form or something, so maybe that's not the entry point quite yet. But you can always supplement those written materials with other strategies to check for patient understanding. And research shows that pairing verbal and written communication improves patient health literacy outcomes. So even thinking about them together or separately, can be a good way to kind of start. And then lastly, attribute 5 is a little broader when we think about the other ones, but I think it's a really important one. And it's a good place to start, or like a good kind of rule of thumb. And it essentially emphasizes this idea of health literacy universal precautions so that, a healthcare provider can implement evidence-based health literacy techniques with all patients. Because research shows that 9 out of 10 patients or individuals are going to experience low health literacy at some point, regardless of their background, of their health literacy level, because so many different factors can influence health literacy in healthcare situations, the patient's environment, right? It's distracting, it's loud, whatever it might be, or their personal factors, because these things are so dynamic.
Yeah, and thank you for that overview. I think that was really helpful context when we're thinking about some of the components of the health literate healthcare organization that we can start to implement or start to consider in our practice. One of the attributes that I found particularly interesting while I was reading the manuscript was the section on effective communication between the patient and the provider. I was just hoping maybe you could discuss a little bit more about the different areas where we can see these communication strategies. For example, I think you said some things about plain language and how we can help with medication safety and review and encouraging questions. If you could just elaborate a little bit more there, that'd be great.
I think one of the first things that we can do is to self-assess your practice, right? And see where this is even happening. And then see where you can implement some of these evidence kind of based techniques or tools. And so if you're thinking about using a plain language dictionary, and there are great ones that are like web based and you can just easily like pull it up and you can use it in your like patient education. You're talking to a patient. Maybe they look, you're checking in. And I think this too is where we have to remember that I think we're smarter than we realize sometimes, right? And we have that expert bias. And so patients often aren't comfortable asking questions or questioning providers. And so I think, again, this is where Attribute 5 comes in, using health literacy universal precautions and always just checking in with ourselves and implementing these tools. So even if we don't think a patient needs it, we should just implement it. So during patient education, have the plain language dictionary pulled up and, check in, do we need to define that or give it to the patient, right? So that they can check in, if they're not comfortable questioning at the time, they can look it up later. The other thing that we can implement for our tools is, you said asking questions. So we do that all the time, but a more effective way is open-ended, right? So instead of saying, do you have questions? Most people are going to be like, nah, I'm good, right? So asking it, what questions do you have for me? And that is more helpful, right? Because now they feel like you want them to ask questions and adding it in throughout. So you can chunk and check, right? So doing it every 3 to 5 pieces of information, and that's more useful. That with the teach back, making sure that you are using an evidence-based structure with it and like seeking feedback, right, from your patients is really important because it's, again, that partnering piece is really helpful.
So, along the lines of what you were just saying about challenging our own selves and how we can grow, if an athletic trainer wanted to learn more about health literacy, I know you plugged the podcast a little bit earlier, but what are some other resources that an athletic trainer can explore in order to learn more about this topic and how they can apply it to their practice?
There's a lot of great translation and utility from other professions and fields that athletic trainers can kind of select from and adapt to meet the needs of their patients and organizations. And I think that's a really important piece too, because in, the public health field and, especially plug it a little bit, but the Agency for Healthcare Quality and Research, so that AHRQ, the Health Literacy Universal Precautions Toolkit, and that health literate healthcare model, that's the purpose, is that it can be modified a little bit. Take what resonates, right? Like look through, get the evidence, right? See what's going to fit and use what you can. And then looking for those modules. So once you understand like what the principles are, you can then look for education about those specific tools or techniques. And so there are ones that are like, what's informed consent, right? Like that's health literacy too. And so I think understanding that it's a really broad concept. And then that's where you build like the next rooms, like you build the next levels of it and looking for the pieces for your practice that are going to be really helpful, right? What do you need to learn? And then what do you want to enhance, right? In your own practice, that's going to be really helpful because different settings, right, are going to need more depth in different things.
Thank you so much again for joining me today. And as a reminder to our listeners, this article is available free of charge by the Journal of Athletic Training. And I highly recommend everyone go and download this manuscript right now in the current special issue for the Journal of Athletic Training. Again, thank you so much, and we will see you all next time.